In London, in Ontario and Canada, we have a mental health system that's fundamentally almost ineffective. The reason for that is because it's chronically underfunded. So the few services that exist over time have evolved these sort of inclusion criteria to be able to protect the resources and the services that they're providing. And of course, that's going to make them worse, right? When you need help and doors are either shut in your face or you're told that you have to wait on a waiting list for months, that's the opposite of helpful. And that's unfortunately the current state of the system in London. TAP stands for the Transition Age Project. And the mandate of the project is really looking at transformational change in the way that services are delivered, particularly mental health services for youth who are of what we call transition age. So between the ages roughly of 16 to 25. When you take any youth that's suffering from any form of mental illness and you look at the journey that they have to take to access any form of help, that journey is an arduous one. It's a very difficult conversation for me to have as a physician with children and families to say, well, the service that you need that's the most evidence-based, that's going to get you better the quickest, just doesn't exist in your community. What we're hoping and what we've started to do with TAP is not only build the service that's based in these sound principles in London, but also be part of a founding group of services that are starting a provincial network in Ontario for transition age mental health services. And it's a service that at the end of the day will follow that youth until they get the help that they need. This project is indeed a game changer because it provides a service that simply doesn't exist in our community. It fundamentally transforms the way that mental health services are delivered from a traditional medical model to an open door concept. And why it's a game changer is because I truly believe that this project has the potential to save people's lives. The London Community Foundation Community Vitality Grant is uniquely positioned to make this grant successful. And why? Because this is a transformational project in the sense that it is building a bridge between sectors that haven't previously connected and worked together in an authentic and meaningful way. Our dreams are of one day having a community hub where we have mental health services, technology is a part of it, primary care is a part of it, education is a part of it. There's a lot that we can do, and this is the seed that through the London Community Foundation we're hoping to begin to plant and watch it grow.